How's it going, Tenafly, New Jersey? This is Kento at Kamiyama Physical Therapy. Today we are going to talk about neck pain. There's a lot of reasonings for neck pain. It is individualized for the most part. What often you see in MRIs are people that have like herniated discs here. But I want to talk about different reasonings that you may have neck pain that you may not have looked at before. A lot of times neck pain can be right here. There's like pain in the neck, sometimes in the throat. Some people have like headaches because of it, or they have that pain right in this area. Or some people have that in the mid-back, upper back area that's always like nagging. And it's not something that is like unbearable. Some people it becomes unbearable, but it's always there when you're working on your computer all the time, let's say, or you're cooking something, or you're doing dishes. So there's a lot of different things out there. And I want to talk about different things because a lot of times we don't look at the process of how you get to neck pain. We almost always look at the result where MRI shows there's a herniated disc. And many times there's other reasonings behind neck pain, which we want to discuss about now. Okay, so let's go into some of the reasons behind neck pain. What we're first going to talk about is breathing. Breathing is a very common thing that I talk about with patients, especially with especially like chronic pains, when it comes to low back pain, neck pain, even hip and maybe jaw pain as well. There's a lot of muscles in the neck when it comes to breathing. And there's muscles here too, in the chest cavity and also a little bit in the abdomen. But many times when we get stressed out, we have a tendency to go up in our breathing. So a ton of it here, or the inability to actually move the rib cage very well. So if you actually take a look at this little screen here, if you look it up here, these are called the scalene muscles right here. And these attach to your upper rib cage right here. And more often than not, when we start breathing like this, often, and you breathe about 20 to 30,000 times a day, we tend to start overworking these muscles. And this is just one reason. There's a bunch of different reasons, but it's the easiest way for me to explain a little bit about neck pain with breathing. And if you start using those muscles all the time, these muscles starts to overactivate as a breathing muscle. And these are muscles that are supplementary, but it's not supposed to be the primary use for breathing. So you may start tightening your neck all the time, which leads to possible neck pain. So many causes for that is the individuals forget how to actually use other parts of the breathing muscles to actually breathe, or because they're so up here, they forget how to exhale. So these are different reasons for that. We'll get into the second reasons in a bit, but that's one reason right there. Okay. So the second reason I want to talk about is vision. With the screens that we have, the phones that we have, amount of screen times that we have, most of the time, or most of our lives, we start to look at things so close by or so focused. So our body will often go to where we look. So let's say if I'm on my screen and I'm looking at it, and if I'm starting looking at it all the time, I'm starting to keep looking something closer. So my head starts to go closer to the screen or something else, or my vision becomes so focused on something that my ability to kind of pull back my head, or the opportunities to pull back my head, decreases. So if you ever gone to like the beach, or let's say you went hiking and you saw the horizon and you saw something such bigger and beautiful things about the nature, and you felt a little more relaxed, it's probably because you didn't have to focus on your eyes so much to the point that your body is like, okay, let me just step back, I'm gonna relax, and your neck relaxes a little bit more. So vision's a big one that we talk about, but it is not as often incorporated more than you think. Okay, so I want to talk about the third one for today, regarding to something that you may not have thought about how it affects the neck joint, is the jaw joint. So many times it has a large influence on the neck. So if you look at the jaw here, the jaw is this area right here, but it's so connected to stress as well. So if you've ever been stressed, or if you've ever seen like a child really being mad, they start going, they start clenching their teeth. Although you may not be doing that on a regular basis, like intentionally, when you are stressed or things that your body feels like there's a threat to the system, this system, the facial system, right, the facial muscles and the systems right here starts to change. So you're creating tension in the joint, which may create the whole body tension a little bit more. So imagine you're kind of like tightening all the time here. You can tell how it tenses your whole body up. And because the neck is the closest thing to the joint, it may affect that area much more. When your jaw is a little more relaxed, or if you remember the times where you're a little more relaxed, you can tell that your face is relaxed, your jaw is relaxed, your neck relaxed, your breathing's a little more relaxed. Those all affect how your neck has to actually activate or hold yourself in space. So checking out the TMJ joint, especially if you have had chronic neck pain, is a great idea. Hopefully this was helpful, but this was the third reason, and for now this is the final reason for today in our video, and hopefully that was helpful.